Let's talk about a huge challenge facing, well, pretty much the whole world. Long-term health conditions like diabetes and heart disease. They're becoming more and more common. But here's the catch. Our healthcare systems were mostly built to handle emergencies, not to manage care over a lifetime. In this explainer, we're going to dig into why that's such a big problem and explore a solution that could totally change how we approach health.
So, just to make sure we're all on the same page, what exactly is a chronic disease? Basically, it's not something like the flu that you get over in a week. It's a condition that sticks around for at least a year, needs consistent medical care, and often affects your day-to-day life. We're talking about things like hypertension, asthma. You get the idea.
And this leads us to the big central question. Think about it. Our healthcare systems are fantastic at patching you up after an accident or curing an infection. They're built for quick, decisive action. But are they really set up to support someone with a condition that could last for decades? That's where the cracks start to show.
So let's pull back the curtain and see what's really going on. This isn't just a small problem. The system is under an incredible amount of strain. Let's look at exactly why it's struggling so much to keep up.
You can see it right here. It's like a perfect storm of problems. First, you've got more and more people needing care, which piles on the workload. Then, you have a shortage of trained staff. That means doctors and nurses are rushed. Maybe they don't have time to follow every guideline. Care becomes disconnected, nobody's following up, and this is the really crucial part, patients are left in the dark, without the skills they need to actually manage their own health.
And the end result of all this? Well, it's pretty grim. You get poor clinical outcomes. The very system that's supposed to be healing people and keeping them healthy ends up failing them when they need it for the long haul.
Okay, so that's the problem. It's a big one, but what if we've been looking at it all wrong? What if, instead of trying to patch up a system that isn't working, we embraced a different philosophy entirely? Well, that's exactly the idea behind something called primary health care, or PHC.
And you know, this isn't some brand new, untested idea. The core philosophy goes way back. This quote from the Alma Ata Declaration says it all. It's about making essential care available to everyone, but also, and this is key, empowering people in communities to take charge of their own health.
So how does this actually work in practice? Well, it really rests on three main pillars. First, you blend day-to-day primary care with bigger picture public health efforts. Second, you look outside the clinic. You recognize that things like education, housing, and even safe parks are all health issues. And third, you actively bring patients and their families into the process, making them partners in their own care, not just passive recipients.
Now, if this approach is so great, you might be wondering why it's not the standard everywhere. Well, one of the biggest hurdles has been this persistent myth that PHC is just a watered-down, cheap version of healthcare for people who can't afford anything else.
But that could not be more wrong. The reality is, PHC is about being smart and comprehensive. It's essential care that's designed to cover most of a person's health needs, not just for a moment in time, but throughout their entire life. From preventative checkups to managing chronic illness and even end-of-life care.
To really get what PHC is all about, we have to make a mental shift. It's about moving away from a narrow focus on simply treating diseases and toward a much broader goal of creating and sustaining overall well-being.
This chart here really nails the difference. Traditional care is reactive. You get sick, you go to the doctor, they tell you what to do. It can feel really fragmented. But primary health care is proactive and coordinated. It's focused on you as a whole person, and it's all about empowering you with the knowledge and support to manage your own health. You're in the driver's seat.
And look at the full scope of it. This isn't just about giving you medicine when you're sick. It starts way earlier, with health promotion and disease prevention. And it continues all the way through treatment, rehabilitation, and supportive care. It truly covers the entire journey of a person's health.
Okay, so we've established that PHC is a powerful solution. The next logical question is, how do we actually make it happen? The great news is there's a real global strategy for this. Let's break down what that looks like.
You can think of the World Health Organization strategy like a three-legged stool. It needs all three legs to be sturdy. The first leg is hands-on support for countries, giving them the tools they need to put PHC into action. The second is evidence and innovation, so we're always learning and improving. And the third is policy and partnerships, which is all about getting governments and organizations on board to make this a global priority.
So what would this actually feel like for you, in your own community? Well, it might mean having a whole team, not just one doctor, working together on your health. It means bringing back that idea of a family doctor who really knows you. It means community programs to help you make healthy choices, and it means empowering you and your family to be champions for your own well-being.
So here's the bottom line, the main takeaway from all of this. This isn't just a hopeful theory. It's backed by evidence. Strong primary health care leads to better health for everyone, higher quality care across the board, and patients who are genuinely more satisfied with their health services. It's a win-win-win. So I want to leave you with one final question to think about. Look at the healthcare system in your own community. Is it fundamentally built to just manage sickness after it happens? Or is it designed to actively build and support well-being from the very beginning? The answer to that question tells you everything you need to know. And if you're not happy with the answer, well, maybe it's time we all started a conversation about building something better.